American Red Cross has been working in Colombia for over a decade now. We started with a number of health programs and have expanded that into disaster risk reduction programs for small rural communities. Many of them are faced with disasters like volcanoes, floods, earthquakes. We work with communities to teach them preparedness so that they can take care of themselves. They're their own first responders. They're going to be able to get to their neighbor the quickest and help them. We work through the Colombian Red Cross, and that's the beauty of how Red Cross works.
They have the relationships with the community. Not only are they volunteers, but they are neighbors. They work to identify what the priorities are. For some communities, it's access to health care, so they developed health brigades. The Red Cross works with government officials and healthcare providers to see that basic healthcare needs are met. They set up a clinic right in the middle of town that often has limited access to medical facilities.
Recently, we've started working on assessment programs where we sit down with the community and say, what is your first priority? Is it reproductive health issues? Teenagers, pregnancy? Do you have concerns about HIV? Is it floods that happen every year? And then we prioritize those with the community, and then we work with the Colombian Red Cross to address them one at a time. What's the most important? Then move on to the next.
Disaster or risk reduction has been the first and most important need for them. They practice it on a monthly basis.
They have about 70,000 volunteers here, which is remarkable. They're very active. I think what's really important is the work with the children. We're involved in so many schools here in the local area teaching preparedness. Today we spent time at a school in Boquia, and we watched the children practice their exercises, and I think most stunning part of it is after they took care of the simulation, and they did a beautiful job of it. They put out fires, they cared for injured children. A few minutes later, a child fell playing soccer and he injured himself. Just when the exercise was over, they started to do what all kids do. They had recess and they started to play games, and he fell and he injured his ankle. And all of the kids here jumped back into action immediately to help take care of the injured child. So we saw firsthand it works, the training works, the kids learn, and then they go home and they teach their parents what they've learned. They teach them earthquake preparedness, they teach them basic first aid, and that knowledge grows and grows.
The work that we've seen in Colombia has been remarkable. The disaster preparedness, the health brigades, the solving community problems from the very fundamental level of what they see their needs are. And the best part of this is that your donations have made this work possible.